Good afternoon, everyone. Thank you for dragging yourselves away from lunch. The viral crisis is something that's very real and something that I've been dealing with in my practice for a good 25 years. And what I'd like to do today is cover three of the most antiviral substances that I know of, that I have personal experience using, and to do a review of the literature with you so that you could see all the fantastic science that has actually been published on these three herbs. Now, as you know, hepatitis C, it's occurring at epidemic proportions all over the world. You've got almost 4 million infected in the USA. That's 4 times those infected with HIV, about 170 million worldwide. And the deaths are up to 10,000 per year, and the mortality is expected to triple by 2010. So we're talking about something very serious and something that conventional medicine has not really made great strides with. It's the most common cause of chronic liver disease, cirrhosis, and liver cancer in the Western Hemisphere. It's now going into the Eastern Hemisphere. 17-fold increase in death from liver disease, a 6-fold increase death from liver cancer. So it's very serious. Current treatment prognosis with interferon and other antivirals like ribavirin, you're talking about less than a 30% response rate after 1 year. And if you look at the 3, 4, and 5-year data, it's pretty disappointing. Of those who exhibit viral clearance, 30 to 70% relapse just within the first few months. And a sustained response of at least 6 months occurs in a mere 10 to 15% of patients. So this is the standard treatment that's available. The side effects of interferon are horrific. I'm just going to name a few of them. Myalgia, fever, headaches. I've seen patients with loss of vision that was permanent. Many patients can't go to work while they're on the therapy. And the decreased risk to progression of liver cancer only occurs in those who were sustained virological responders. We're talking about a very, very small percentage. Ribavirin, when combined with interferon, show a 28 to 66% sustained response in 28 to 66% of patients, but that's only looking at 1 year. The side effects when you combine these two drugs together is about the worst thing you'll ever see in your life. The side effects are absolutely horrible. I've had infectious disease specialists call me and ask me, do you have anything up your sleeve? Because quite frankly, I can't, in good conscience, give these drugs to my patients anymore. Now that's a pretty severe thing for someone to say who's head of infectious disease in a hospital. And I guess the question is the treatment worse than the disease? Now there are other forms of interferon. They have a pegylated interferon that just increases the amount of time it stays in the body, but still it's given with ribavirin. The side effects are just as bad. The prognosis doesn't really change, and if you don't have insurance, there isn't a chance that you can afford this drug treatment anyway. There's no way that you could afford it. It may increase response rate, the pegylated interferon, but there's no long-term studies more than 1 to 2 years. And like I said, when you go past a year, the response rate drops terribly. Now, enter glycyrrhizin. I've been using glycyrrhizin in my practice for about 25 years. Yes, I did start when I was 12. And glycyrrhizin is by far the most antiviral substance I've ever used in my practice. I've used it for hep C, I've used it for condyloma, I've used it for, I like to call the herb viruses or us. It works for just about any viral entity I've seen. Now, most of the research focused on a drug that was developed in Japan called stronger neominophagin C, abbreviated SNMC. And glycyrrhizin is a conjugate of glycyrrhetinic acid and glucuronic acid. And when you take glycyrrhizin, it's metabolized in the intestines to glycyrrhetinic acid. If you take it IV, it is excreted through the bile, and it's also metabolized to glycyrrhetinic acid. So it doesn't really matter which one you use. They really both work the same, and they get metabolized into glycyrrhetinic acid anyway. Now, what has it been shown to be effective for in the literature? Hepatitis A, B, and C, I have patients, I have to knock on my head, alive and well. In the late 80s, early 90s, most of my practice was working with HIV and AIDS. I have patients alive and well, absolutely because of that herb. It actually has been shown to be superior to AZT, but don't tell anybody. Herpes, simplex 1 and 2, herpes zoster, I have used it for these things. It works like a charm. The literature shows that it works quite well. It may be effective against human herpes virus 6, lichen planus, influenza. I'm going to show you a study a little bit later on, cytomegalovirus, and there's also quite a bit of data on cancer. I just don't have enough time to cover it with you today. I've used it with chronic fatigue. I have to tell you that it's my main source of success using this with monolaurin, which I'll talk about in a little bit. I've used it for Epstein-Barr. I've used it for cytomegalovirus. I've used it for condyloma. I've used it for many different types of viruses with great results. And what's great about it is that if somebody is taking conventional treatment for hepatitis, it actually makes the interferon and ribavirin more effective, maybe even a little less toxic. We know the mechanism of action. There's been a great amount of science done. It can inhibit some RNA transcriptases like in HIV. It has indirect antiviral. It decreases cell membrane permeability, so it can decrease hepatocyte injury. It inactivates viruses. It inhibits viral proliferation. And it's a free radical scavenger. It's a very, very powerful antioxidant. It increases endogenous gamma interferon. It increases T cells, it increases natural killer cells, which may be one of the reasons why it also works for cancer. It also inhibits the cytolytic reactivity of the complement system, and it does not inhibit, in fact it may enhance, immune adherence responsible for immune phagocytosis, regulation of antibody production, and protective immunity against invaders. So a lot of work and a lot of science has been done on this particular herb. It also is anti-inflammatory. It inhibits the arachidonic acid cascade. Now, the SNMC composition, I'm going to go through the 20 milliliter ampule because that's normally what's used. Most people don't use 4 milligrams. The dose is too low. So a 20 milliliter ampule has 40 milligrams of glycyrrhizin, 400 milligrams of glycine, and 20 milligrams of L-lysine. And the therapeutic range is usually 40 to 60 mLs, so you're talking about upwards of 200 milligrams of glycyrrhizin. That's how much is used for a treatment dose most of the time. It also has aminoacetic acid and L-cysteine, because one of the things you have to watch for is pseudoaldosteronism. Doesn't happen that often, but watch for it anyway.